Warts, even the name sounds unpleasant. Warts can be disfiguring and frustrating, as they are difficult to treat and do not have a definite cure. If you are burdened by the embarrassment of a common wart on your hand, face, foot, or other body part, this information will give you basic steps on how to help get rid of it. Be patient. Warts are caused by HPV, human papillomavirus, and as such, can take quite a bit of time to eliminate naturally by one's immune system. Some warts will disappear over time, without treatment. However, time could mean anywhere from a couple weeks to a couple of years, so you may wish to choose a more active method. Whichever method you choose, allow it time to work. Some methods are faster acting than others. The fastest method to removing warts permanently is using 100% TCA. With this method, results are often seen in less than 10 days and are permanent. It is also the cheapest and is discussed later. Use salicylic acid or 100% trichloroacetic acid, TCA. Salicylic acid is the ingredient of most over-the-counter wart removers, including Compound W and Occlusal. Its effectiveness varies and it can take weeks for it to work. Soak the skin in water for 5 minutes or longer, apply the acid liberally using the brush and let it dry, leave it for a day. You can either peel or file it off and then file remaining dead skin. Do this every 2 or 3 days. Use duct tape. Several studies have tried to assess the effectiveness of duct tape in removing warts. Duct tape occlusion therapy, DTOT, is supposed to localize medication in the general wart area as well as choke the wart itself. One study found that duct tape following the application of imiquimod 5% cream was an effective treatment against the common wart. However, it takes a long time, can take up to 6 months, and usually people don't see success with this. Apply cantharidin. Ask your doctor about using cantharidin, a fast-acting chemical that will burn away the wart. Unfortunately, it can be really expensive, upwards of $500. There is some pain involved, but you may see results in just a day. The doctor applies cantharidin directly on the wart, then applies a bandage. The next day, the bandage is taken off and the dead skin is removed. If it doesn't work in one treatment, you may need another method. Your doctor will make appropriate recommendations. Try liquid nitrogen. Another remedy your doctor may try is liquid nitrogen, or cryotherapy, to freeze the wart. It may cause some discomfort, and can take a few treatments to completely remove a wart, but can be very effective. If it's not, then the wart will usually come back bigger with bigger blood vessels and be almost impossible to remove. Alternately, many drugstores carry OTC freeze treatments to zap the wart. If using an OTC wart freeze treatment, keep the following tips in mind. Follow the direction on the wart removal package. Your skin should turn from white to red in a matter of minutes, and a blister should begin to form underneath the wart. Small black dots should appear beneath the wart after a few days. This is a sign that the treatment is working. Resist the urge to pull the wart off. The wart should fall off on its own. If it doesn't, treat again after 2 weeks. Do not treat a wart that has been unsuccessfully treated 3 times. See a doctor. Burn the wart off. When other methods fail, burning the wart off may be what's needed. There will be some pain involved, and burning can lead to scarring, so the best recommendation is to let your doctor handle it. However, you can try this at home, if you're brave enough. See your doctor. They can use a laser to burn the wart away. This is sometimes effective, but best recommended after other methods have failed. Try it at home, light a match, blow it out, and while the match head is still hot, touch it to the wart. This causes blistering that initiates a healing response. Peel the layer of infected skin off, and cover with aloe and a strip bandage. Repeat as necessary. Try this at your own risk. Very dangerous. Have your doctor cut it out. When in doubt, have your doctor remove the wart by cutting it out surgically. This is something best left to a doctor, to prevent infection, and so that a local anesthetic can be used to mitigate the pain. A doctor will either do this by electrosurgery and curettage. This is where the doctor burns the wart with an electrical current and cuts it out afterward. The wart may still return because the blood vessels are still intact. Laser surgery. This is where the doctor burns the wart with an intense beam of light. Consider immunotherapy. Your doctor will be able to counsel you on this treatment, which uses your body's own defenses to attack the wart. Ask your doctor about Virigen. This is a new medication that is used to treat genital warts as well as other warts. Use imiquimod. This is a topical cream that is used to treat some types of warts and skin cancers by stimulating an immune response. It does not cure warts, but it may help, in concert with other treatments. Ask your doctor for guidance. Encourage antibodies. Ice the wart, then sterilize a needle and poke deep into the wart several times, taking care to penetrate every layer of skin in the wart. By introducing the virus to your bloodstream, you help your body see the wart and fight against it, which can lead to its disappearance from your body. This method is very effective for some people, especially for those with several warts, as even the poking of one wart on your body can help your body discover the others and destroy them. Cover it in vitamin C. Crush a vitamin C tablet and add water to make a thick paste. Apply it to the wart and then cover it with a bandage. Leave it on for the day, then at night let it breathe. Take off bandage. Wrap it in vitamin E. Break a vitamin E capsule and rub a little of the oil on the wart. Cover it with an adhesive bandage. Remove the bandage at night to let it breathe, then start over with the oil in the morning. Repeat 3 times a day. Use hot water and pumice. Soak the wart in hot water until it softens. Scrape it down with a piece of coarse exfoliating pumice until you reach level with the skin. Take bleach on a cotton swab and hold it against the wart for 15 minutes. This may sting a bit. You must wash the area well after applying bleach. Apply tea tree oil. Dab a little on the wart and cover with a strip bandage. Do this for up to 3 weeks. Try castor oil. The acid in castor oil irritates the wart and works best on small, flat warts on the face and back of hands. Apply castor oil to the wart with a cotton swab twice a day. Use aspirin. Take a few aspirins and crunch them up, adding a few drops of water. Take the mixture and put it onto the affected wart areas, then apply an adhesive bandage. Leave on overnight. Aspirin is the ingestible form of salicylic acid, but much cheaper than most commercial lotions. Try some betadine, iodine, also called iodine. Apply the betadine to the wart and cover with a bandage and leave for 1 or 2 days, then refresh bandage. Put toothpaste on the wart and apply an adhesive bandage. Leave for a day and repeat until the wart is gone.